Well, good afternoon, everyone, and thanks for spending your fall Saturday with us. My name is Mike Walsh, and I'm a Rare New England board member and also founder and CEO of Patient Advocacy Strategies. And I'm really privileged to introduce this next discussion with three absolute A-list patient advocates, each of whom have dedicated their purpose in life to improving the lives of those facing health challenges. You'll hear from each of them directly in a moment, but I'd like to share their bios so that they can elaborate on them as we examine the role that resilience plays in their ongoing advocacy for patients and caregivers living with and advocating for a rare disease health challenge. So let me get to the panel here. Let's start with Jen. Jen McNary is currently Executive Director and Head of Patient Engagement at Fulcrum Therapeutics. She's also a trusted voice in the rare community as a mother, public speaker, and advocate. Formerly, she was Director of Outreach and Advocacy at a Massachusetts-based nonprofit foundation. She was responsible for the organization of the largest FDA advisory committee hearing in history, with over 1,000 Duchenne muscular dystrophy advocates, families, clinicians, and researchers in attendance. There are currently 3 drugs approved for Duchenne, and Jen was involved in the approval process for each of the 3. She has a unique experience in drug development as a parent of children enrolled in clinical trials, an advocate engaging with regulators, and as a consultant helping to develop programming for patients. Along with her role at Fulcrum, Jen serves as the founder of One Rare, a nonprofit formed to meet the needs of young adults with rare and chronic conditions, and is raising her 4 children in Massachusetts. Jen, thanks for joining us today, and you have the floor.
Thanks so much, Mike. And I realized I need to update that. We now have 4 drugs for Duchenne. I really appreciate it. I'm going to share just a little bit about my journey here in just a moment. If I can, oh, it's not letting me share the screen. Hang on one sec. There we go. So I appreciate everybody taking some time on this beautiful Saturday to spend some time with us as we talk a little bit about caregiving and what that's meant for my family. As Mike mentioned, I'm a rare mom. I'm the mother of 3 young men who live with rare conditions. My older 2 sons are 22 and 19, and you'll actually hear from Austin a little bit later in the day, so stay tuned for that. And then I have a 14-year-old son who also lives with a rare disease, and you can see here him pictured with me, and he lives with primary immune deficiency. And then I also have a 10-year-old daughter, and then a few foster kiddos who live with me as well. So I decided to really focus on the evolution of our caregiving, of my caregiving of my children throughout the years, and kind of what that has meant for me as a human, as a mother, and how I've really had to pivot through the years to do what needs to be done. Because I think one of the great things about caregivers, and everybody on this panel is a terrific example of sort of being nimble and changing as you need to change and learning what you need to learn in order to take care of that person that you love. Visual here is my son looking out at the water. This was shortly before his diagnosis with primary immune deficiency. So the caregiving starts with the diagnosis, and it may even start with a non-diagnosis, as it did with James. But with Austin and Max, they were diagnosed with Duchenne muscular dystrophy pretty close to birth at 3 years and 3 months old. And I really call this the period of time where you spend time healing your heart. And you get rid of that expectation that you had for your life. Everything has changed, everything's different, and everything from this point on is the after diagnosis. So I speak in my life as the before diagnosis and the after diagnosis. Lucky for me, or in my mind, lucky for me, is that I didn't have a whole lot of expectations because Austin and Max were diagnosed when I was 21 years old. And so I really didn't have a whole lot of thoughts and wishes for my children as they grew up. And so we grew up together, and we grew up with Duchenne. So the next section of our lives I call the triage mode. And that's really the time where you're an active participant in your child's care. You are looking for that care team. You're looking for that family, that rare family, whether it's other members of the Duchenne muscular dystrophy community for us, or the infamous or famous Dr. Jerry Mendell, pictured here with Austin and Max at his lab in Ohio. It's developing those support networks and parenting through Duchenne. We were learning how to meet their basic education and day-to-day needs, and really pivoting when Austin came off his feet at the age of 10 and understanding how to care for a non-ambulant patient. It was, it was obviously a really devastating part of our lives, and a time where I felt really isolated. It's one thing to have children with a devastating diagnosis, but when you put them on wheels, you lose a lot of the people that are your network, that are your family, because of accessibility issues, because of fear, and it became a really tough time in my life where I was really isolated. I was home with my guys a lot, and having trouble finding those people that could really help with them. And then of course you're also trying to meet their emotional needs. It's always a really emotional period of time as the kids kind of settle into their diagnosis. So it kind of moves into this period of time where you're sharing decision making. And this is pictured here is Max signing his assent forms at age 9 for his first clinical trial. This is a time where you're making decisions for and with your children, and it's a time where you're choosing treatments or medications or looking for new treatments or medications. This was a time where I had to really get educated and learn. And I do not have a medical background, but in order to make these decisions, you have to learn how to understand data. You have to learn how much risk are you willing to take, whether it's in clinical trials, or a story that I like to tell around Austin is he was a daredevil. He's always been a daredevil. And kind of deciding how much risk was I willing to assume on his behalf. He will tell you, I think, that we were big risk takers, both in the clinical trial world, signing up for medications that had never been tested, but also in sports and athletics. My guys are skiers. Austin broke his elbow. And he broke his leg going to a party with friends as they carried him up a hill because he couldn't get up in his wheelchair. And so we as a family have decided to assume a lot of risk, even though, as a caregiver, that was always really hard for me. But making that decision to kind of let my kids have their wings and fly, and give up a little bit of control. And then, of course, coming into adulthood, and this is where I am with the guys now. And it's a hard period of adulthood with a progressive neuromuscular disease like Duchenne, in that you're balancing the constant and consistent loss of physical abilities, and trying to balance that with autonomy in educational needs, decision making, and the need to separate from mom a little bit. And I think Austin's kind of a golden example of a kid that just, he's a first kid birth order wise, and I think that makes a difference, but kind of pushing through the barriers and really becoming his own person. And as a mother, and a caregiver, and somebody who's been charged with making almost all of the decisions for all of these years, my job is to sit back and give advice and give information when asked for it, but not to be overbearing. And I'll give an example of that. Recently, the guys were asked if they wanted to screen for a clinical trial, and it's one that I'm excited about. And Austin at first said, "No, I'm not interested." And I really had to bite my tongue, and I had to step back and I had to say, okay, you have to make your decision. Luckily, he did do some conversing with other folks and some scientists that I've given him access to and that he's had access to, and he did decide to screen, but then he was turned down for the study because his disease was too far progressed. And so really mitigating that sadness and, them being upset and really, that grief process has been a whole new thing for us as he, really progresses further in his disease. So, this is kind of where we are right now, but then there's the what's next. And I think when we think about resilience, I often think of myself as this little plant here, kind of pushing through all of the pavement all of the time and climbing up hills as they're placed in front of me. And I think that, I am always looking back to see what I've learned from where we've been, but also looking forward and trying to get ready and prepare for the next part of the journey, which, could be really exciting, but it also could be devastating again when you have a terminal illness and just learning how to take care of yourself through that journey. So I appreciate everybody kind of being here today to hear and to talk, and I'm hopeful that we will have some great conversation with the rest of my amazing panel.
That's great, Jen. Thanks. We'll come back to you in a minute, but thanks for that intro. Those are great insights. Next up, I'd like to introduce Dr. Nina Nazar. Dr. Nizar serves as founder and executive director of Jansen's Foundation. She's a rare disease advocate and change leader in the rare disease community. Dr. Nazar has a doctoral degree in education leadership from Creighton University. She's a TEDx speaker and also a blogger and inclusion advocate. She's the 2018 Nebraska Mother of the Year and is also a rare disease patient and a mother of 2 boys with Jansen's metaphyseal chondrodysplasia, a disease that affects less than 30 people worldwide. So welcome, Nina. Thank you for joining us post-operatively. We're glad to have you and really appreciate you coming here. We'd love to hear your perspective on your journey.
Yeah, absolutely. And thank you all for joining this morning. And thank you to Jen McNary. You know, I've always been a big fan, and it's really a great panel we have here today. So, you know, I'd like to start by kind of talking a little bit about my own journey. It's a little different from Jen's in the sense that not only am I a parent to children who have a rare disease, but I have a rare disease myself. I have the same disease that my children have. And so my take on resilience is a little bit different. So it's kind of, it's going to be a little bit of a different perspective because one, I'm looking at the road from the eyes of not just a mother to children who have a rare disease, but as the rare disease patient herself, and how can I be resilient, and how do I then pave a path for my children that is their own, but at the same time I give input and sort of help along the way. So it's been a little bit of a different journey for us. And the other thing I wanted to state by going through is like giving you a glimpse into what our journey has been like. And as I speak through this, I'm going to talk a little bit about, you know, how at every stage, what did resilience mean to me, and how did that actually manifest in the decisions I took. So I actually grew up in Dubai, and I was born and raised in Dubai in the Middle East. And when I was born, there was absolutely no, there was nothing. There was miles and miles of sand, no Google, nothing, no expert opinions. And I was actually started with, like many of us, with a misdiagnosis. Now my story actually starts from here in terms of how I saw resilience and how I saw hope, even when things were so in the dark. And my earliest memory when I was 8 years old is my father, who's an engineer. He would tie me to an ironing board and he would keep me straight. And he would say to doctors, her bones are bending, and they wouldn't believe him. But this was my image in my mind of growing up with a rare disease. It was one of trying everything, trying things, even though doors closed and you never got answers. My father, he saw it as with the tools he had to be able to provide solutions the best he knew how. And so it's that mindset that really became the foundation for how I grew up. And I think in the Christmas of 2009, when I actually, you know, had my first son, against a lot of medical, you know, diagnosis that said, oh, you will never have children. And we were in the process of adopting when Arshan actually came along. And we named him Arshan. It means Persian for a very good man. And at the time, you know, I want to talk a little bit about, you know, when you have a rare disease, one of the things that you think about is like, you know, you can't have a family, because that's some of the notions out there, and some of the ideas that we are forced to accept and move on with. And so we did, and we were actually in the plans of believing it. And lo and behold, Arshan came along, and Arshan was quite different, and he had no sign of disease. And, you know, we really enjoyed him, and we were absolutely astonished with all the milestones he achieved. And then 2 years later, you know, Jahan came along, and we named him the Savior, because he actually, at that point when he came on, you know, Arshan had started to regress dramatically. And all of these, you know, it goes back to what Jen Jen spoke about, that whole grieving period. And for me, it was grief of an exponential nature, in the sense I had to grieve, not just for my children, but also for myself. In that, with Jahan, I actually got a diagnosis, and we realized we were 3 of 30 people living with the condition, Jansen's metaphyseal chondrodysplasia, and it was such a rare disease that there was absolutely no information out there. And again, it goes back to, how do you create resilience in yourself when you are faced with such uncertainty, or with such darkness, in that, you could easily choose to crumble. And what we did is what I know a lot of rare disease parents and caregivers do. We left our jobs, we left our lives in Dubai, and we actually came to America in 2015 to search for this one man in the picture, who had written one little anecdote in a paper on rare bone disease, and where he said we could probably turn off the overactive PTH receptor, which was the root cause of our condition, by an inverse agonist. And that one line was really the symbol of hope for us. And so when we talk about resilience, how far are you willing to go? What are you willing to do in order to change the narrative, right? In order to change the trajectory of your life. And so, just as Jen mentioned, having the wherewithal to actually make those things happen. And we were lucky enough to find Dr. Jupner, and actually he had been researching the disease for 20 years and never met a patient. And then he met me for the first time, and then he met my 2 boys, and that began a journey that we are still on today. And we formed the Jansen's Foundation in 2017, found others who were all children who had been, again, with this diagnosis, but had no hope. So resilience is also turning our own personal hopes and our own personal fears into action, not just for us, but also for our community members, for others that perhaps we have never met, but share a similar journey. We found this Jansen's Foundation, and we began to publish papers. And then when we talk about resilience and rare disease, especially one that is progressive, like Jen said, how do we cope with that? How do we cope with, constantly falling back, waiting for treatments, waiting for change, and knowing that the mountain you have to climb is so high, but yet if you even stop to look around you, you feel like you're going to crumble. And so for me, the constant reminder was my children as they were growing up in front of me, having surgery after surgery to correct their bends and the pain that they go through daily, my own pain that I had to suppress in order to be the leader of the foundation, to make sure that we moved our mission forward, was really the fire that moved me. And these are just some images of my son's legs, before and after surgery. And 3 months after surgery, it's back to how it looked before. And, the constant questioning from your children as to, when is this going to get better, or is this going to get better? And when you have little children, it's much harder for them to understand. But as Jen also pointed out, as they get older, it presents with a whole range of other difficulties. And so we decided to find other warriors around the world. We found 5 in America itself, and in summer of 2017, we all came together. And then resilience is also about taking action. And then it is about presenting your findings. It is about sort of charting a new course in with the one hope of changing the narrative. And so we were able to find a PTH receptor and inverse agonist that they're now working on. And the good news is, in all of this, we as a family have to put ourselves out there, right? And I think that is the hardest thing to do in this journey of resilience, because you are attacked constantly by people who don't understand your journey. Oh, why did you have 2 children if you knew you had a genetic disease? All of these very harsh comments, sometimes from people within our own community, within our own families. And how do you cope with that? And yet at the same time, put your family out there so that there is funding and there is enough movement to move your mission. I think we'll talk a little bit about cultivating emotional intelligence in order to build resilience. And so I want to end by saying that this is not an easy path. It is not a skill that you just wake up with and decide, I'm going to be resilient today. It is a work in progress. And I want to say that, we are right now at a point where we just gave a protocol to the FDA for the first in-human trial. And again, we had COVID that really, shot us a bullet kind of because of our timelines. We're all, sent a scatter. And so we have to really regroup and try to work again. But Jen's done some amazing work to be able to get 4 trials for her disease. Here we're struggling with 1. So I know the difficulty that it goes into, but I want to end by saying that, there's so much hope at the end of all of this really dark journey that you can make a difference. And I think that's what continues to help us, keep going. And so I want to just end this slide by just saying that, you can't, if you're committed to something, if you're really thinking about change, and it can happen if you just continue to do so and keep that vision very clear in your mind as to what is the outcome you're looking to achieve. Thank you.
Well, thank you, Nina. It's indeed a work in progress, but you've made incredible impact to date. So kudos and unbelievably inspiring. So thank you. And again, we'll come back with some questions in a moment. But to round out our panel, I'm really thrilled to welcome an old friend and Rich Pezzillo to the program. A lot of you may know Rich. Rich is currently the executive director of the New England Hemophilia Association. Prior to joining NEHA, Rich worked in DC as the press secretary for US Senator Sheldon Whitehouse of Rhode Island. And he was then communications and marketing director for the Hemophilia Federation of America. Rich is also the former co-chair of the National Hemophilia Foundation's Youth Leadership Institute and is the recipient of the Ryan Waite Meritorious Service Award, as well as an NHF Advocate of the Year award. To add to that, he's also been recognized as 40 Under 40 winner for the Association of Healthcare Philanthropy and Providence Business News. So very prominent advocate in Rich. He graduated from Western Connecticut State University and currently resides in Providence. So Rich, as we dig a little deeper here on the resilience theme, I'll ask you, your advocacy journey has always appeared from the outside, to me at least, to be smooth and effective continuum, making valuable impact at every turn at the national, regional, and local levels. But I'm sure it's not always been as smooth as it looked from the outside, and that you've had periodic challenges along the way. Wondered if you could, in addition to telling us a little bit more about your background, could you speak to how you've embraced a sense of resilience in persevering through some of these challenges?
Sure, absolutely. Thank you, Mike, for that introduction. And it is great to be here with you. I'm honored to be on this panel, and I love the way that the presentation just ended about warriors. So often, rare diseases, you are advocating for yourself nonstop, whether it's in school, work, at the doctor's office, etc. So I'll just start by saying that I have hemophilia myself, and I am probably typical with other rare disease patients of, growing up, this was something that I hated. I didn't want anything to do with it. It was the furthest thing from my mind in terms of accepting it as a part of who I am versus wishing that it would just go away. And I think that's a big piece of resilience, to answer Mike's question as I got involved. I think a big piece of understanding who you are as a rare disease patient, whether it is an adult or a child or a caregiver, is coming to terms with it on your own time. We often see with the New England Hemophilia Association that there will be individuals of newly diagnosed mothers that have newborns that jump right in. And then we have those that may not, this may not be where they need the support right now, and it may take them some time, and that's okay. We always say that the door is open for you when you are ready. And I think that when I look back at my journey and think about Mike's question and think about this, the question or the term resilience, I often go back to kind of that pinnacle moment for me. So for those that don't know, hemophilia is considered a rare disease. There's only about 20,000 people in the country with it. I do reside, as Mike mentioned, in Rhode Island, and there's less than 100 people in Rhode Island out of about 1 million that have hemophilia. It's been in my family. My grandfather had it. He passed away in 1988. I have a brother with it, and I have 2 cousins with it as well. As you may or may not be aware, our community has gone through quite a bit when you think about the term resilience. The bad blood era contained the contamination of the blood supply in the 80s resulted in over 10,000 men and their partners, women and men, passing away. So we have a big gap due to HIV, AIDS, and hepatitis C that decimated our community. So when I look at someone like myself who's pushing 40, the age disparities in our community is anyone really over the age of 40, 50, 60 starts declining majorly because of our past and what this community has been through. So resilience really is a term that comes to mind so often when I think about our history within the bleeding disorder community, especially with hemophilia. Personally, as Mike mentioned, I worked on Capitol Hill, and which was completely unexpected. I actually went to school to be a meteorologist. Ever since I was a kid, I wanted to forecast the weather. I wanted to be the next Jim Cantore and chase tornadoes. I actually picked the school I went to. So I started at Linden State, but for many of us with rare diseases, your life often takes a different 180, so to speak, and I had to switch schools due to health reasons. But I picked the school initially because Jim Cantore went there. So many kids have idols that may be movie stars. Mine was a weatherman. But I tell you that because getting involved at a young age when I was in college opened so many doors. It opened doors that I would have never considered to be open, like working on Capitol Hill. And a big piece of that now that I tell young adults, regardless of what chronic condition, or if they don't have a chronic condition, is get involved with something larger than who you are. Because when you get in something larger than who you are, it starts developing you into a character. And then you start looking at these types of endeavors that you have as missions and not jobs anymore, because you believe in something that you want to put your whole heart and soul into. So a big piece was advocating down in DC, like many groups do, to your delegation, federal delegation. And for those that may not be aware, hemophilia is one of the most expensive conditions to have per patient. My medicine alone is about $350,000 a year. So I take an IV infusion every other day to keep my levels from bleeding. A lot of people think it's external. I get asked a lot about paper cuts and nicks and shaving, and that's not the case. It's internal bleeding inside of joints and muscles. Normal things when you fall could lead into pretty major issues. And I'll be the first one to say that as you get older, you become lazy sometimes and you skip your infusion, especially when you're on a prophylactic basis. So that's something that I encourage myself and others, especially with young adults, to think about accountability and think about when you do have a chronic condition, staying on top of that too. But like many of us go down to DC, I shared my story and it's like, oh, this is cool. This is my first time doing it. And I gave my explanation of benefits. This is back in 2006. And at that time, I had an inhibitor, which means that my body rejected the clotting factor that I put through IV. And it was well over $1 million for that year. So Lifetime Caps has changed our community, or the elimination of them. So the Health LA at the time pinned it to her wall. I gave her a copy of the EOB. And she called me 6 months later and said, the senator wants to do a floor speech about hemophilia and the cost and how our healthcare system's broken. That led to an unexpected relationship and then an internship in DC. And then, as Mike mentioned, a full-time job. I mention all that because it's a path I never thought I would ever take, working on Capitol Hill and having that road open. It would not have been open if it wasn't for having a chronic condition. I often propose this at our teen retreats with the New England Hemophilia Association to young adults, that if you had a magic wand and you can take away your chronic condition, would you? And almost all the time, the young adults will say, absolutely, I hate that I have a bleeding disorder. I hate that I have hemophilia. And then we start talking about it, and they start realizing that if they took their bleeding disorder away, they wouldn't have the friendships that they have, they wouldn't have the opportunities that they have, they wouldn't have the experiences. I mean, having a chronic condition sucks, period. It is not fun to deal with anything that you have to go through, the hospitalizations, the dollars that you have to dish out, or the medication that you use. But the experiences that have been presented have been so rewarding in the sense that it's giving me a sense of purpose, and it's giving me a sense of mission. So, Mike, it was very kind of you to say that it looks easy from the advocacy perspective, but I think in many times too, what I've learned without having an advocacy training or medical training, I have a science background, but it's about not giving up. It's about knowing that you will fight for something, and you will do it not with pitchforks and torches, but you will do it in a collaborative effort. You will do it by listening. You will treat others the way that you want to be treated, and you will get let down, especially I think in the advocacy front with bills. I mean, for those in Massachusetts, we've been fighting for step therapy for 10 years, it seems like. The sunset provision for copay assistance, every 2 years it expires. It's expiring again January 1st, 2023. And some of these things can be exhausting, but it's also inspiring that the more that we come together, the more powerful we are in terms of our voices being heard on a state level and on a federal level. So I'll just kind of leave it like that there is a lot of work that goes in it, and it certainly is not flawless, but at the end of the day, it's about working together. And I'm constantly inspired by so many of you and the stories that I heard on this panel this morning of chronic conditions that I may not be as well informed about, but certainly there are so many similarities in terms of the challenges that we all have to go through day in, day out, and the extra responsibilities that you have as kids, adults, and as human beings. So Mike, I'll turn it back over to you.
Great, Rich. Thank you. Awesome insights as usual. And I guess along the lines of not giving up, right? And Jen, I guess I can throw this your way, and then you all can comment as you wish. But, we know that demonstrating resilience is often easier said than done, right? So especially in unprecedented times like, a pandemic lockdown. So from a practical standpoint, are there actual, hints or advice that you could give other advocates and advocacy organizations when it comes to actually demonstrating this resilience that we know we need to persevere, but can often be hard to embrace in challenging and unprecedented times like this?
Sure. I mean, one of the things that I really ramped into kind of overdrive with COVID. And as a reminder, my son James has primary immune deficiency. And so, as I like to say, my family was like mask and hand sanitizer savvy, and we were ready for something like COVID. But, on a serious note, giving us grace, giving our whole family grace. The first lockdown, we were home for 14 weeks and I had to let my caregivers go. The only people in were the infusion nurses, and I had high anxiety about that. I was home with my 3 chronically ill kids, 2 in wheelchairs, and my daughter. And, all of our mental health really suffered. I was traveling for work. I was used to having colleagues. As a single mom, I was getting out there, and that's how I got my cup filled. And when I stopped being able to go and go to conferences with people like Nina and other people that really fill my cup, it was giving myself grace and giving my family grace, and knowing that, if we just vegged out and watched movies because we couldn't focus, that was okay. And if we were less productive, that was okay. And I find even now, this is ongoing, right? This is forever. This is anxiety provoking. But just knowing that you can pick it back up tomorrow. And so if you put it down, you can pick it back up. And then also another thing that I think I've learned in the past now 18 months is the ability to pass the torch and let other people help. Whether that's, the fact that I hired somebody to help me with housekeeping, right? I was tired and it was a lot. Or whether that's trusting somebody in your advocacy efforts and not feeling like you have to do it all on your own. And some of that has been trusting my son, who's capable and able, and letting him be capable and able to run our foundation, but also trusting colleagues and trusting other community members to be capable and able, because everybody can do something, but nobody can do everything. And I think that's something I've definitely learned over the last couple of years.
So well said. And
I'd like,
yeah, go right ahead, Nina.
oh no, go ahead, Mike.
Well, I was just actually going to pitch it to you. There have been some questions come in that I think you could probably speak to, around how have you helped your family deal with the stress that's brought on right during the pandemic? And again, along the lines of practical guidance, do you have any stress reduction techniques that work well that you could share with others?
Yes, sure. And, I want to sort of piggyback off some of the things that Jen said. So, the whole COVID thing has really been stressful to everybody, but for people with rare disease, it's been a very reflective period of time. Not only are we, as Jen mentioned, used to quarantining or isolation because of, so I have 3 wheelchairs in the house, and I know Jen can understand this. We rarely are able to go out and socialize like others could because of the constraints that we have to, and all of the thinking that goes into actually socializing and mobilizing. We prefer to stay at home. So quarantining and isolation was not unusual to us, but it did bring a level of anxiety and stress adjusting to the fact that, somebody could bring a sickness home, the fact that we couldn't get respite care, the fact that we had to have a prolonged sheltering in place, right? What does that mean to us as rare patients, as rare caregivers? We saw more disappointment about not seeing friends and anxiety about getting sick. We saw that our teens were sad about not having things like graduation or other milestone events that perhaps they've been expecting, but, and these are the small things that, because we've been excluded from other small milestones, these things were important. These feelings can definitely feed into isolation and symptoms of depression. And, before we even know it, we're probably depressed without even realizing it. I know that initially we would have these sessions on Zoom where a lot of our rare parents just came together and just hung out, but then it became difficult to even do that because we were so Zoom fatigued. So, and then the whole idea of reintegration, right? As places began to open up and society entered this reintegration phase, we were still nervous, right? We were still nervous about going out, wondering what we should do. And teens, parents, children were feeling nervous about seeing friends, even in a way that was safe. So we had extra layers of challenges on top of the unknowns of a chronic condition and everything that we have to undergo as our default. So I want to speak a little bit about the emotional resilience. Like, how do we get through this, and how do we say that it's all right, and how do we actually vocalize that it's not all right, and how do we cope with that? So it might not seem like much, but we do have some control. And what I'd like to talk about is, again, kind of structuring some of what Jen said. It's about self-care, right? What is self-care? It should not be an afterthought. And in most cases, when we're a rare patient or a rare caregiver, we think of self-care only at the end of everything else. But if we plan it out, even if we have 1 or 2 minutes of the day to ourselves, even to have those 2 minutes to cry, to really cry, and that's not wrong. And it's important to model that for your kids, how to do that. How to really take a minute to let it all out and just have that meltdown or have that controlled moment where we can be ourselves in a vulnerable situation. And managing anxiety can be done in many ways. We can manage it with paced breathing. Take a minute of the day to focus on your breathing. It really helps because just taking in a deep breath through your nose and letting it out through your mouth, inhaling slowly and deeply until your lungs are really full and you feel like you can exhale slowly. And deep breathing helps you to manage stress and anxiety in the moment, but also in long term, because it tells your body to calm down. It sends a message to the brain that you're okay and you can handle what you're about to face. And then resist thinking traps, right? Everything is not black and white. Assuming everything is perfect or wonderful or everything is terrible, we're going to avoid that. And we have to also avoid catastrophic thinking, expecting the worst possible outcome and believing, oh my God, I'm not going to be able to cope if that outcome occurs. And then we have to also be careful about predicting the future, imagining that you know what will happen for the future. For instance, I won't be able to go to school again. Or like my son tells me, this pain is never going to end. We'll never get a treatment. Or I'll never be able to go to college. Or I'll never be able to get this wheelchair through that door. So predicting the future can be one of those thinking traps. And how do you avoid these traps? You need to catch yourself. You need to notice that when you're spiraling into that trap. You might start feeling sad, panicky, or hopeless, right? And then you catch yourself. Be more realistic or holistic about your thoughts. Ask yourself or talk to a trusted friend or family member and what's real and not real about your thoughts? What are the gray areas? Are you missing any in-between possibilities that are more realistic? I began to really, last year my son was in hospital. He had he had 4 surgeries in the space of 2 months. It was horrible. And he went into a complete pit of despair. And to the point where we had to get a counselor to see him in the hospital. And they brought in a counselor who deals with sick or dying children who were on hospice. That's the kind of counselor my son had to seek out. And the counselor spent, 10 minutes with him and he turned to me and he said, I have no answers for him. Everything he's saying is so well articulated. He understands exactly what his feelings are. He's able to articulate it and so much more eloquently than an adult could. And there is no answers for some of the questions we have. And that becomes very, very susceptible to find yourself in thinking traps because of that. And I began to think of the situation as how am I going to help him? And as a family, we decided to push him into, he's a great artist. He's always been a doodler and he draws. But last year, we just completely immersed him in art as a healing therapy. So we had to catch him in that position and think of an action plan quickly. And so that he did not go deeper into that where he would feel so hopeless that there would be no return. And now he has his own art website where he sells his art. He does a lot of rare disease paintings, and he has discovered a whole new way of coping with his feelings, and he puts it and depicts it on paper. So use a coping mantra, like things like, I'm doing the best I can. I'm going to be okay. And even if I'm not okay, I will find a way to get out. And being able to turn down that intensity of emotion can lead to more self-care and more effective behavior for ourselves. The other thing I asked him to do was to sort of keep a gratitude journal, like start writing things that you are happy for, and he began to see that there were things that were not all just, as I said, black or white. Focus on silver linings, think that shift in thinking can affect how we feel. If I can help us manage emotions, and then what do we do in response? So again, the last one I want to talk about before, but engage in behavioral activation. So what is that? Like, physical, like even if you can't exercise, I have started to get him to do deep breathing. I've started getting him to lie down and exercise or do things that he will be able to do just for the beneficial piece of, of his disease, but also to gather some time to himself. Again, painting, creative drawing, jigsaw puzzles, anything that can take your mind off and focus on outward activities will help. And I like what one of the panelists said about thinking larger terms in community, right? Mastering a skill, any of these things should help you. Or you might even create a sort of sensory toolkit to help you turn down intensity of anxiety, like, and ground yourself, and so the 5 senses, something visually pleasing. Like I like gardening. I started doing that a lot when I get really stressed. I'll go to my garden. I like to have certain smells I like, touching, feeling, hearing, taste, things that you really feed the senses will allow you to sort of calm yourselves down. And then turn off things that really upset you, like news. I mean, at one point I was so upset that they were throwing so much money into COVID and rare diseases funding was at a standstill, and I was like, my gosh, if they threw all that money into rare diseases, we'd have more treatments today than we've ever had, and that was really upsetting me. So I had to disconnect from news. Sometimes I had to turn off social media completely to be able to just ground myself in the moment. So and then if everything doesn't work, please reach out and get professional help, because it's perfectly normal to say, I just can't do this. I need somebody more professional to help me.
Well said. Thank you, Nina. Thanks for sharing. Rich, I wondered if you could talk about how you, if you don't mind my asking, balance managing your own health, right? Which could be a full-time job in and of itself, to, with your advocacy efforts.
Yeah, there's been a lot of things that I would echo in terms of it's hard to turn something off when you believe in it, right? When you are an advocate, you want to continue to go until there's an end, and sometimes there is no end. But I agree about finding the balance within yourself and with what you spend your time with, whether it's family. I also love to garden. So I have plants that give me joy, taking a walk, doing some type of exercise. Depending on mobility issues, there are so many things that we are able to do. Growing up, I was never encouraged to play contact sports or any sports of that matter, but biking has been really great. And I found myself, in those therapeutic moments, that it really does help when you spend time with yourself and try to process things. Journaling too, I think, goes a long way to try to look at some of these things. And I think too, the burnout is real when you're living with a chronic condition and you're also doing it, whether it's a volunteer position or you are in the field itself. There is a real red flag that burnout could be there. So I think knowing your own body, knowing those around you, and communicating that, no one's meant to take on the world. No one's meant to do this ourselves, and we're never alone with that. But I think it's important that whether it's your spouse or your children, finding those things that can be watching those movies or going out and incorporating the normalcy. I don't really love the word normalcy, but I also know too that it incorporates into everyday life. Each one of us here has a story of what someone from the general public can say, well, that's just crazy. How do you do that? I get asked a lot, how do you had ports as a kid and you start an IV on yourself, and I could never do that. And I always say, you would if you had to and you had no choice. In developing worlds, those that without treatment for hemophilia have a life expectancy of 27 years old. That means I would have been gone 15 years ago, give or take. So I think in some ways it's like brushing your teeth. It becomes part of who we are. And there's a level there of helping others to walk your journey the same way that I want to walk someone else's journey, and be inspired and hopefully can help make a difference.
That's great. These are such valuable pearls of wisdom. And it makes me think, of what can we do? And I'll throw this out to anybody, what can we do as an advocacy community more broadly to foster more cross-pollination across disease areas, to, not recreate the wheel, and take learnings from each of your respective disease areas and amplify them throughout, not just rare disease, but right, Rich, we were talking about this from the policy advocacy standpoint. There are so many different conditions that might work in silos that have the same policy issues, and they have the same patient support needs, and there's so much that we can share, but a lot of times, disease specific advocacy doesn't always foster, the cross-pollination that sometimes is required to maximize everything that the three of you guys just said. I don't know if Jen, you've worked across disease areas. Is there a way that we could be more proactive about fostering just broader cross-pollination of ideas and best practices?
So I don't have a magic answer, but as you mentioned, I work across disease areas, and I think that's one way to do it, right? I mean, currently working in rare, very rare diseases like sickle cell and like FSHD, diseases that have a high unmet need. And I'm also working in disease states like major depressive disorder, right? And you wouldn't think that these things go together at all, but they do, right? We all have similar access and reimbursement challenges. We have similar stigma issues. We have similar issues with pain and with isolation, and with jobs and education. And so one of the ways that we tried to do it is by training the next generation. And again, you're going to hear Austin talk about this a little later, but I'm really passionate about the foundation that we founded for young adults living with rare conditions, rather than young adults with Duchenne, young adults with hemophilia, young adults with Jansen's, right? It's a time for all of these young adults to come together and realize that they have a lot in common. And what we've seen through our camps, and again, I'm probably stealing Austin's thunder here, but what we've seen in our camps is these kids, right? I'm going to call them kids. They're adults, 18 to 35, but they're coming together and they're sharing knowledge across the group. And they're also, hopefully going to be in person next year. And we're going to see those with mobility challenges matched up with those who don't have those mobility challenges. And can they actually help each other get through? And so I think the broad answer is to stop siloing it and start coming together. Meetings like this, Rare New England, it's Rare Diseases, Every Life Foundation, NORD, Global Genes, these organizations that, you can meet together. Ultra rare conditions can kind of learn from some of those conditions like Duchenne that have been around forever, and you don't have to recreate it. And then we're also seeing it on the company side. We're seeing things like the Rare Disease Company Coalition, which a good friend of mine in DC is facilitating. But that's a place where tiny companies can come together and work on common policy. And so, having patient organizations and patients really encourage their tiny little foundations, tiny little companies to work to have a bigger voice. And I think it is NORD that says, together we are rare. Alone we are rare, together we're common. I don't even know, something like that. Somebody correct me, but it's just this idea of a broader voice and a bigger voice, and understanding that we are not uncommon. Maybe individually we are, but together we kind of have this bigger voice and bigger spot in the world.
Mm-hmm.
Well said. That's great. Well, I think we're almost about out of time, but I can't thank you three enough for your insights. As we conclude the discussion, any parting thoughts?
Sorry, I was typing. Somebody's got to have some parting thoughts.
Yeah, go ahead.
I think that, I've always liked this 17th century Japanese poet, Mizuta Mashide, and he said, "My barn having burned down, I can now see the moon." So I want to leave you with that. I mean, it's kind of back to what Richard said. If he didn't have his condition, he wouldn't have been on the path he's on. I think we're all, as sucky as it is, and we're all, we have our moments, we're all on this really great opportunity to make a difference. Going back to what Jen said about, bringing it all together. One of the reasons why COVID, got not just one or two or different treatments was because it affected everyone, right? Whereas for us, we're still so siloed, even though our diseases affect us in terms of accessibility, in terms of death rate, and in terms of, young kids being affected. There's still not that sense of urgency for us to come together, right? So hopefully understanding resilience would also mean collaborating across diseases for a better outcome for everybody.
And I can add that I look at, there's this tree I once saw where it was knocked over from a storm, but yet it still grew. So the bark ended up going parallel to the ground, and then it just shot up. And then from there, the roots started growing. And I think so often as those are chronic conditions are that tree, we're knocked down many times but we hold our own and we rely on each other. And I think sometimes, especially in 2021, when social media plays a big role on it, I like the advice that we heard of sometimes you just need to shut that off. It's okay to disconnect from the world, and it's okay to not be okay as well. We talked a lot about, positive yet negative things that have come out of, positive things that have come out of negative, but there's a lot of struggle that also goes along living with a chronic condition and representing patients that go along with it. So I would say rely on each other's, be sponges, and make sure that, like that tree, that we continue to not be knocked down and just keep growing those roots wherever we can.
Well, I can't think of a better place to close this out than on the heels of that comment, Rich. So thank you. So Jen, Nina, Rich, thank you so much for on behalf of Rare New England, as well as me personally, for all you do, your leadership and your inspiration to patients everywhere. Thank you very much.
Thanks so much.
Thank you for joining.
Thank you.